Hey fam, I want you to like, share, and subscribe to our YouTube channel, youtube.com/Roland S. Martin. And don't forget to turn on your notifications. All right, folks, heart disease and stroke are leading causes of death among all Americans, with heart disease being #1. The risk is even higher for African Americans, and the reasons vary. Poor food choices, limited access to healthy foods, and a lack of education about what you should and shouldn't eat, to name a few. The American Heart Association is launching a strategy to work on community-based solutions by offering funding to entrepreneurs, HBCUs, and businesses. Take a look at one of their campaign videos. All right, folks, joining us right now is Pamela Garmon Johnson, the Vice President of Multicultural Markets for the American Heart Association, and Tanya Odom, Senior Consultant for the Future Work Institute and co-author of Evaluation in the Field of Education for Democracy, Human Rights, and Tolerance. Certainly glad to have both of you on Roland Martin Unfiltered. Now, let me go to Tanya. Tanya, obviously, when you talk about connecting with entrepreneurs at HBCUs, you talk about the next generation of folks, but who also are, working and doing things with their own family, whether they're mothers and fathers and grandmothers and grandfathers. And so why is that so critical?
Well, I think it's a couple of things. Just listening to a couple of the other guests you had on before, people are addressing the issues that they're facing, right? So disparate outcomes in terms of healthcare, health access, access to healthy foods, as you mentioned. But what this is doing is actually going to HBCUs and taking the sort of, as Pamela was saying, innovation, intelligence, and new ideas that are there and helping to solve issues within our communities. And I think, when you look at issues of equity, that's the way to do it. It's really looking at some of the systems that haven't always given people access to things like this accelerator program, which has funding and opportunities to really get your idea out there and working for different groups of people. Okay.
Do we have Pamela? You still there?
I'm here. Can you hear me now?
Okay, there we go. So, yeah, that audio sounds a lot better. So Pamela, obviously, when you look at the numbers, African Americans are more impacted, more so than anyone else. And so, have you seen the results of targeted programming that has been able to impact the numbers and how they impact African Americans?
Roland, that's a very interesting question, because we launched the campaign back in 2008, where we were specifically focusing on African Americans. Over the course of 5 years, we saw a reduction in the number of people that had a stroke, as well as death. Since we moved away and had more of a broader approach across the country about all, we have seen an uptick in both stroke and heart disease, specifically with African Americans. So we know that when we have a very targeted strategy within zip codes with specific populations, we can make an impact. That's because we're all rowing in the same direction. And especially when you have limited resources, you can't spread yourself so thin, you can never, ever move the needle. But when we're all taking our little bit and being able to pull it together, it makes a lot. And then we're all rowing in that direction to make an impact. So we directly see the impact of that, and that's the reason why we are partnering with HBCUs. We know that there is the ability to work as a collaborative, work alongside HBCUs and other organizations to make an impact in our community.
And Tanya, at the end of the day, when you talk about where do you apply resources, it should be going to the area that has the most need.
Absolutely. And it should be going equally to those areas, right? One of the things Pamela and I talk about a lot, and we talk about in the Diversity Leadership Committee, is these accelerators are sort of incubators for people who don't necessarily have access to the funds, to the resources, to the ability to get their message out via social media in a good way. And I think one of the things Pamela, talks about is these accelerator communities. We've seen people, even if they may not win, quote, the top prize, get access to funding or get access to sort of opportunities to expand their ideas, to go in front of other sort of VCs and to be able to move their idea.
I want to bring in my panelists, other panelists here, and so Kelly, Malik, as well as Shane. And so, Kelly, I'll start with you. Your question. Go. For Tanya or Pamela.
For either person, I just wanted to know how you're going to link your mission regarding the HBCUs with food deserts, because my understanding, especially with rural HBCUs, there aren't a whole lot of places to get fresh food and the like at an affordable rate. So do you have a solution? Are you working towards a solution for that problem?
Kelly, one thing that we have with the accelerator is able to think a lot of solutions that allow for information of food from urban centers into communities that are rural. So, for instance, in Dallas, Texas, with one particular church, they were to work with farmers in rural communities in order to provide the transportation needed to transport food where our food a lot of expense within transportation. And so we can look to how we create new businesses, even around transportation, transporting food from one place to another. It's a huge opportunity for an entrepreneur to come in to solve that problem. We've actually seen that. Same thing even in urban centers. People think because you live in the city that you have access. But most people that are in urban centers, especially those that are in under-resourced areas where they are living in a food desert, then they may have to go they may have to take 2 or 3 different buses just to access food. And so we've actually been able to, even in the Baltimore area, work with a grocery store that actually provides the opportunity to use mobile kitchens, teach people how to utilize the food. Then they created an app for them to be able to order their food and have it to order and delivered to them. So they take the transportation piece out of it altogether. So if you just think about those different types of models that are in the marketplace, being able to accelerate that through these accelerators and giving venture capitalists the ability to fund those, enable us to be able to scale that both at the rural level as well as in our...
Malik, your question.
Actually, I just wanted to piggyback off of what Kelly said. In my area, I think we have about 80 or so thousand residents, and we have 1 grocery store. So the idea of food deserts is really a thing. But one question that I wanted to ask is whether or not, for either of you, what has your relationship or, efforts been as far as contacting the administration? I know that Jonathan Holyfield, I think he's the executive director of the White House's HBCU initiative, and also our Surgeon General, Vice Admiral Jerome Adams. I know he's really been pushing a lot of healthy initiatives just really related to black people. So I just wanted to know what has been your success in reaching out to the administration to get some support on this.
I'll speak to this at a very high level because the American Heart Association is a nonpartisan organization. So we work with all administrations. So our CEO, Nancy Brown, has worked very closely with the Surgeon General as well as our Chief Science Officer, specifically around those policies that disproportionately impact people of color. So, for instance, we look at smoking, nicotine, we look at sugar-sweetened beverages, and knowing that advertising disproportionately is to those that are black and brown, and that
it's on her though.
So here's the deal. I'm I'm having very choppy audio with Pamela. So I'm going to do this here. Shane, last question, if it can be for Tanya, because Pam's audio is really breaking up. So Shane, your question for Tanya.
Yeah, so Tanya, there's a gentleman named Ron Finley out of Los Angeles, here in Los Angeles, who actually had to get an ordinance change to grow fresh food. How are you all looking to partner, you know, with, and I know this is an issue across the map because I've heard it in other cities. How are you all looking to deal with this issue and ensuring that these ordinances in different cities are changed so that folks can actually have access but grow fresh food?
Yeah, I mean,
got it. Tanya, go ahead.
Better than I would answer it from American Heart perspective. But what I can tell you that I do know just from my work with the American Heart as a volunteer is that's where some of these accelerators come in, right? The American Heart is so.
Well, we were having some Skype issues there with Tanya and Pamela. First off, so let me let you know, folks, that on Monday, we're going to be broadcasting live from Greensboro, North Carolina, where the American Heart Association is going to be having a competition there, 5 HBCUs competing for grants on this very issue. So we look forward to broadcasting from there. So we want to thank Pamela and Tanya again. Sorry about the audio issues there, but again, glad to have them on the show.
Roland Martin Unfiltered. Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real. As Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. RolandMartinUnfiltered.com.